2 days, we have lined up several exciting sessions which will cater to varied interests of all our delegates. We are sure that these days would be a great learning experience where you would be able to interact and get a broader perspective of the healthcare industry.
Let us begin the much-awaited seminar with a keynote address. This address revolves around the successful healthcare models under various domains of healthcare. To give this keynote address, we have with us Dr. Rajiv Yeravdekar. Dr. Rajiv Yeravdekar graduated from the prestigious Medical College, Pune in General Surgery and Obstetrics and Gynecology. He was awarded the Gold Medal by Pune University for his outstanding academic performance. He has been awarded PhD under the Faculty of Management by University of Pune. Sir was invited by the Ministry of Health, Sultanate of Oman, where his work was highly appreciated. On completion of this assignment, Dr. Rajiv conceptualized and established the Faculty of Health and Biomedical Sciences at the Symbiosis International University. Dr. Rajiv is Dean of Faculty of Health and Biomedical Sciences, Symbiosis International University, ex-member, Board of Governors of the Medical Council of India, Governing Council of Consultancy Development Center, Ministry of Science and Technology, Government of India, Central Supervisory Board, Preconception and Prenatal Diagnostic Techniques, Maharashtra Medical Council, Maharashtra Nursing Council, various professional bodies like Federation of Obstetrics and Gynecological Societies of India, and many others. He is also a member, Managing Committee, Symbiosis Society of Board of Management, Symbiosis International University. I now request Dr. Rajiv Yeravdekar, sir, to come up to the dais and address the gathering.
Hello, am I audible? Hello, am I audible? Please don't say I'm looking like Harsha Bogle. Well, friends, I'll be taking you over the next 28 minutes over what they have nomenclatured as the keynote address. It is not conventional or traditional or customary that the organizer gives the keynote address. I shall refer to this point sometime later during my presentation. Well, I plan to give a talk on what this concept of change, innovation, entrepreneurship, intrapreneurship, and most importantly, the denominator called as game changers. What is all this concept about? How do we relate it to the case studies? What are the implications of these game changers in society at large and with specific reference to the healthcare sector? What challenges were faced by these game changers whom we are going to showcase in my presentation and the illustrious speakers who are going to follow stage during the 2 days course of the national seminar? And for you delegate students, what I think can be the take-home message. So basically, who is an entrepreneur? An entrepreneur who is one who doesn't sit in the confines of an AC room like you are sitting right now, who prefers change as a means of growth. Basically, he wants to change a scenario, a situation. Is prepared to take a calculated risk. In doing so, has the out-of-the-box approach away from the traditional conventional customary. In doing so, is aware what lies ahead of him, both positively as a means of success or negatively impacting him, possibility of negatively impacting him should there be failure. So he's not afraid to take challenges at all. And therefore, entrepreneurship is a system adopted by one individual, groups of individuals who adopt specific knowledge, skills, and competencies to bring about this change, either starting zero or modifying the system as is present. And the most important is the last line, it is for the common good and not for the good of one individual or one small individual. It is for the good of the community or society at large. If there is an entrepreneur, there is also an entrepreneur. Surprisingly, when we were tackling entrepreneur, it comes as spell check. There is no word as entrepreneur in the COT, and COT stands for Concise Observation. And entrepreneur An entrepreneur is basically an entrepreneur who works within a closed system, whom he or she knows better, and therefore tries to bring those innovative ideas, but within the confines or bracket of an institution or an organization. Now, this is a model which is worth emulating, worth successful. Yes, and the world over, it has been proven to be of success. Classical example, Google 3M. Google allows its employees to use 20% of their office time, not in the cafeteria, not in the canteen, not in the park, but to innovate. And what is the output? You've got Google Apps, you've got Google Earth, and Google Mail. It fosters the sense of ownership, accountability for within their employees. So the employees don't feel as employees, they are involved as important stakeholders. It is basically, there is a challenge scenario which requires what we call as an orbit shifting challenge. Satellites are going in their orbits, and suddenly they move out in the conventional tradition, elliptical or circular pathway, and they go out of their orbit and create history. That's what we are referring to. That leads to either an entrepreneur or an intrapreneur or an innovator, or you would like, who dreams, sets targets, has well-defined strategies, most importantly, well-defined objectives to effect what we call as change. So change is fundamental. There is no going beyond change. You want to change the system, you want to change individuals, you want to change society. That is the bottom line. So this change, either to entrepreneurship or to intrapreneurship, leads to innovation, and innovation in turn brings to the theme of this national seminar, what are game changers? So who are these game changers? They have changed the game. Now, game changers are there in every walk of life. They could be in the business models, they could be in the way we transact with people, they are in politics. I am not a proponent of इस बार अभी सरकार मोदी सरकार और वुमेन एम्पावरमेंट आपके साथ हमेशा साथ आपका हाथ नहीं लगेगा. Not talking about game changers proposed to be in politics. I am not talking about the game changers of e-banking, which has changed the customary shopping from going to malls, tagging along with your wife bag behind, and sitting in the confines and just doing e-banking. I am not talking about that. In India, there are only two things which sell. What are they? Bollywood and cricket, right? So let's think about what these game changers are in Bollywood and in cricket. In the 60s, 70s, mid-70s, you had the hero prancing around behind the heroine, going around in circles, around the trees, and when there was a romantic scenes, all of us are adults here. The kissing used to be shown by birds coming together, cars bending, and whatnot. So there was a concept of a traditional chocolate hero. And this chocolate hero was one who is drawing. Came the mid-80s, and this gentleman changed the way the heroes were looked at as soft chocolate heroes to someone as dashing and as the angry young man.
इसे अपनी जेब में रख ले पीटर. अब ये ताला मैं तेरी जेब से चाबी निकाल कर ही खोलूंगा.
So this gentleman became the game changer as the angry young man, and therefore he is rightly nomenclatured as the Shahenshah. So you had after Bachchan coming Govinda and Ajay Devgan and many other, no disrespect meant. But who emerged as the star of the millennium is not these guys, but the Shahenshah, Amitabh Bachchan. So this guy has been the game changer in Bollywood. Now let's see the game changers in cricket. Another religion which is followed. You had bowlers bowling on the leg stump. You had bowlers bowling bouncers. And आज के IPL के ज़माने में T20 में every ball lost is an opportunity lost. Every ball is potentially being capable of being clouted for a six. So what did Sachin do? He said, okay, you bowl me a bouncer, I'll invent a stroke. What did Dhoni say? You bowl me around your pads, on the leg stump drifting down, I'll hit you for a six. What are these game-changing strategies? Have a look at this video.
Used all So these two guys have been the game changers. You bowl a short ball, Sachin hit it with, invented the stroke called as the uppercut, went for a 6, and as the commentator said, so he used the pace of the bowler to his own advantage. Then you had Dhoni, who had the helicopter shot. So these guys have brought something out of the box. You also had videos of Dilshan scoop. How many of you are aware of the Dilshan scoop? Good. And I'm particularly happy about the Dilshan scoop. You know why? Because that's what with Misbah attempted, and in 2007 got us the World Cup of T20. So I'm particularly impressed. So these are multiple examples within cricket, within Bollywood, who have been game changers, as the name goes. Now, when you have someone who wants to disrupt and bring about disruptive innovation or a change in the ecosystem, there's a common fabric or a common setting under which all these things and ideas and all individuals and circumstances collate. Let's have a look at what each of these are. One, there is a sense of urgency. People want to do something different. Chal yaar, utke kuch to bhi karenge, aisa nahi hona chahiye. So there's one individual or one group of individuals who want to say, come, let's get up, we want to do something different. There is a spirit of inquiry. They will not accept what is conventional, what is going on. They want to do something differently. Why this is going on? Why can't it be done differently? How can it be done differently? Then they get together a guiding vision. And when you study the case history of Symbiosis, you shall see that all of these elements fall in place. How should they be going about addressing this problem? They get the vision right. They have got vision. They don't have sight alone. There's a difference between sight and vision, friends. So they get the vision right. They communicate their thought process for a buy-in. They try to convince. They try to defeat by logic rather than by dictatorship. Stakeholder enrollment at all levels, be it students, be it staff, be it the community at large, be it the police, be it the customers, consumers, whatsoever, whosoever. There's a high level of engagement. They've got a passion. They are obsessed. They are seized by it. And when they talk about high level of engagement, they say that they infect people. Without getting into the sexual connotation, I would say they go beyond impacting them, beyond infecting them, to inseminating them. That's the idea which they inject lethally into the individuals so that each group, members of the group, start talking, walking, breathing the same mission. They empower action. They create short-term wins, small baby steps which lead to a sense of achievement. They don't let up. They combat entropy and dilution, which is likely to come in as the organization grows. So this is something where we are particularly conscious within Symbiosis as a case study group, where we are constantly focusing on the right quality and constantly aware of what might go wrong. Remember, as Azim Premji rightly says, your biggest enemy is your past success. So the moment you start becoming complacent, resting on your past laurels, you had it. Make changes stick. So set behind a legacy impact. Don't make it a one-stop or a stopgap arrangement to, just put up a patch to the existing system. Be a game changer, make an impact. Now, when you talk about healthcare entrepreneurship in India, a horde of possibilities open up. Multitude problems, myriad problems, small solutions, limited solutions possible. So 1.2 billion population, problems of population, problems of poverty, problems of illiteracy, problems of ignorance, problems of tradition, problems of taboos. Huge number. One of the problems of the mobiles also. But in an emerging economy like India, resources are less. And I'm not talking about the human resources in which we are rich, very, very rich. This large audience is a classical example of rich human resources. But I'm talking about material or financial resources. So it's time that we, as the healthcare fraternity, get up and start questioning ourselves, have that sense of urgency where we say that yes, we need to do something to bring about affordable healthcare, we need to bring about accessible healthcare, we need to bring about accountable healthcare, we need to bring about equity in healthcare, so on and so forth, jargons with which the public health experts are very familiar with. But what do we have in India? In India, any sort of innovation, you try to think differently, people talk about jugaad. कुछ तो भी करेंगे यार, कुछ तो भी 420 ही करेंगे. Small time solutions to beat life's hassles. And so you see, all these are examples of jugaad. There is no impact, legacy. Then one day one legislation will come and say that gas cylinders cannot be fitted in the car and this jugaad will fall out of favor. Someone will come and say that no, you can't have those, tractor machine fitted on that motorcycle. That jugaad got invented in Punjab. Dasmeet, am I right? So Punjabis, no disrespect meant, are known to be good jugaadis. So that's about jugaad, But in India, unfortunately, it is that you need to have some sort of a lasting impact, a disruptive innovation which will shake the world of the healthcare sector. That gets us to the concept of game changers. So, now what is this concept of game changers? Forget the lady in golden, she was looking beautiful, I know. Dasmeet, all your actions were on her, eyes were on her, and my young students were also watching her. But the concept is that in a cricket match, again I'm coming back to cricket religion in India, game changers are not those cheer girls who come on stage when a 4 or 6 is hit with their clout and with their fanciful dresses. It is these game changers like Dhoni, Sachin, or Kevin Peterson, or Dilshan, or anyone who lead to the scenario where these game changers emerge. And you saw that the girl was dancing first, and then the guy got up and started doing these things. So she infected him probably, and that's how the chain reaction got about. And that's today something which was not there in cricket few years back. Cheerleaders have now become an integral part. I'm not talking about the Gulf or the UAE where cheerleaders are banned. But in most part of the world where cricket is played, the Commonwealth countries, cheerleaders are a feature. So that gets us to the case studies which I would like to share with you about the game changers in the healthcare sector. The Swasthya Slate, most importantly launched by, basically is a small computer and a tablet attached to it. It has the capacity to analyze 33 specimens, be it blood, sugar, urine, even water from portable public sites, analyzes the samples, feeds it into a tablet by way of a Bluetooth communication, and the tablet in turn is connected to a remote sensor by a 3G technology. So what has this done? It has addressed problems of access to care, data collection, and most importantly, data analytics. The impact in Andhra Pradesh, where it was launched as a pilot project, a set of 10 investigations which would have normally costed 1,000 rupees now comes at a meager cost of only 78 rupees. So that's the for you. Then comes the gentleman, an NRI in Stanford, who talks about Mr. Manu Prakash, who has invented this $1 origami microscope, costing a few $100 rather. And the important thing is, infectious diseases, which used to be required and access to a microscope was denied. So the problems of infection control, education of getting a microscope to the masses, and cost of care all have been addressed. Manu Prakash is in Stanford University along with his colleagues. Cloud, game changer in healthcare. We all have problems of huge amounts of data in the healthcare. How do we handle confidentiality issues, HIPAA compatibility, and most importantly, access to data, especially in remote areas. Now everyone, including in the healthcare sector, are on Cloud 9 because they have access to cloud healthcare data analysis. Robots have invaded the healthcare system, brought about revolutionary, impactful ways of handling patient load, specimens, or samples. The Athon TUG, which is launched recently, what happens typically in a hospital? Small, narrow corridors, because most space is utilized by the patient's room.